Your heart. So is it alright if we pull up your shirt?
Sure.
Okay. So we're going to listen aortic, pulmonic, Erb's point, tricuspid, and mitral. And then we're going to switch it to the bell and do aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. Now if you will stand up for me, I'm going to palpate your spine. So if you'll just turn this way, we're going to lift your shirt up. Alright, will you bend over just a little bit for me? Alright, it looks like her spine is midline. Alright, and under your shirt, we're just going to go ahead and do your rise and fall of your chest. So will you breathe in for me? Alright, if you'll turn this way, we're going to do the front. Will you just breathe in for me? Okay, perfect. And while you're here, we're just going to go ahead and do, if you will say 99 for me.
99.
Alright, and turn around. We're going to do the same on the back. You say 99 for me.
99.
And one more time.
99.
Alright, her symmetry is good. Now we're going to go ahead, we're going to listen to the front of you. We're going to listen to your lungs. Alright, so there are 10 spots to listen to on the front. Alright, is that alright if we lift your shirt up one more time? Okay. Alright, and then we're going to go ahead and do the back. And there are 18 spots on the back. Okay, that's good. You can go ahead and put your shirt down. Alright, and you can go ahead and sit back on the bed. Alright, we're going to inspect her arms. Alright, everything looks good. Alright, and her nails. There is no clubbing of the nails. We're going to check capillary refill. Alright, capillary refill is good. We're going to go ahead and do her reflexes, or her pulses. We're going to do her biceps, brachial, sorry, and radial. Alright, and if you will squeeze my fingers for me. Alright, so now for your bicep, I'm going to need you to hold your arm like this. Alright, and will you flex your bicep for me, please? Alright, you can go ahead and relax. Alright, now with one finger, I would hit over my finger to assess that. Alright, now if you will lay down for me, please. We are going to assess the stomach. Is it alright if we look for sure? Alright, so we're going to go ahead and assess her stomach. There seems to be no abnormalities. Alright, we are going to assess your bowel sounds. We are going to start in the right lower quadrant. Alright, and if no bowel sounds are present, you would need to listen for a full 5 minutes before you state that. We're going to go ahead with the bell of the stethoscope and listen to the aortic valve, the renal, the iliac, and then the femoral would be down here. Alright, we're going to go ahead and palpate her stomach. Tell me if there's any tenderness. Any tenderness? All right, and there seems to be no bladder distension.
Now, I'm going to palpate your neck if that is all right with you.
Yes.
Okay. So her trachea is midline, and there's no signs of masses or lesions. Good job. My patient is sitting upright. She is breathing room air, and two accessory muscles are the intercostals and trapezius. So now I'm going to palpate your back. Can you stand up for me, please? Your posterior thorax. So her spine is midline and straight. Can I have you take a deep breath for me, please? All right, my fingers during chest expansion expanded about 2 inches, which is perfect. So now I'm going to auscultate. So every time I put my stethoscope down, I'm going to need you to breathe in through your nose and out through your mouth. Okay. All your lung sounds were clear in all lung fields. So I can sit back down. I'm going to auscultate your anterior thorax. So again, just breathe in and out when I set the stethoscope down. And again, all lung sounds were clear in all lung fields. So now I'm going to assess your abdomen, so please lay down for me. Her skin color is tan with no color variations. There's no lesions or distensions. There's no pulsations. It is flat. Her umbilicus is inverted. There's no redness or lesions. Do you have any pain anywhere? No. Okay, so I'm going to listen. If you had pain, we'd have to end in the quadrant of pain, but since you don't, we're going to start in the right lower quadrant. All your quadrants are symmetrical. Her vowel sounds were about 8 to 10, which is active in all 4 quadrants. Now I'm going to palpate. Do you have any pain in your abdomen?
No.
Do you have any pain here?
Mm-mm.
Any here? Here? What about here? 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 Any pain here?
No.
Any here?
No.
All right, perfect. She had no pain, no guarding or distension, no grimacing. So now I need you to sit up. I'm going to do a kidney test. So I'm going to put my hand back here. Any pain or tension?
No.
Any pain or distension?
No.
All right, good. There was no pain or distension.